Good afternoon. In the dissection hall, we have finished the dissection of triangles of neck. Our next dissection is going to be the cranial cavity. So before we start dissection of the cranial cavity, I would like to give a brief description about the cranial nerves. Before I describe the cranial nerves, let us see a brief case history. A 30-year-old man was brought to the casualty with a history of road traffic accident. On examination, he was found to have a leak from the nose. A clear watery fluid was leaking from the nose, and the X-ray and the CT showed that he had a fracture of the base of anterior cranial fossa. And he complained of anosmia, that is the loss of smell. So what can be the cause? We will find out the answer to this question at the end of the session, okay? Do you know the meaning of the word cranial nerves? What are cranial nerves? The nerves which emerge from the brain, or nerves which end in the brain, they are called the cranial nerves. So they have to pass through various foramina or fissures in the cranium or the skull bones. That is why they are called the cranial nerves. That is the definition of the cranial nerves. How many cranial nerves are there? I think in your school days you have studied that there are 12 pairs of cranial nerves, isn't it? But the recent theory is that there are 13 pairs of cranial nerves. You are shocked now, isn't it? Actually, there are 13 pairs of cranial nerves. So please remember, from today onwards, whenever somebody asks you how many cranial nerves are there, you have to answer 13 pairs of cranial nerves are there. Let us see the names of the cranial nerves and why they are called by specific names. Which is the first cranial nerve? It is the olfactory nerve. It is concerned with which sense? Sense of smell, olfaction. That is why it is called the olfactory nerve. The second cranial nerve is the optic nerve. The sense of vision is carried through the optic nerve. The third cranial nerve is the oculomotor, and the fourth cranial nerve is the trochlear. I have given a different color for the word trochlear to highlight the point that it is the only cranial nerve that emerges from the dorsal aspect of the brain. Only cranial nerve emerges from the dorsal aspect of brain. This is often asked for your viva, and sometimes it is asked for objective type examination also. The fifth cranial nerve I have highlighted with another color to show that it is the thickest cranial nerve. Out of the 13 pairs of cranial nerves, the trigeminal nerve or the fifth cranial nerve is the thickest. The sixth cranial nerve is called the abducens nerve. It has the longest intracranial course. Abducens nerve has the longest intracranial course. The seventh cranial nerve is the facial nerve, supplying the muscles of the face. Eighth cranial nerve, in your school classes you must have studied auditory, but a better terminology is vestibulocochlear because it supplies the semicircular canals and it also supplies the cochlea, the organ of hearing and the organ of balance. That is why this nerve is called the vestibulocochlear. The 9th cranial nerve is called the glossopharyngeal nerve. 10th one is called the vagus. The 11th cranial nerve is the accessory. 12th cranial nerve is hypoglossal. And the last one, or the terminal one, it is called the nervi terminalis. Easy to remember, the terminal or the last nerve, that is nervi terminalis. So you should remember this name, because some of the students still don't know that a 13th pair of nerve exists. Coming to the meaning of each word and a brief explanation about the course and its function. That is the aim of this class. Olfactory means concerned with the olfaction or the sense of smell. You know, it is through the nose that we are receiving the smell. How many olfactory nerves are there? So far, I have explained that there are 13 pairs of cells, but it is not true in the case of olfactory nerve. We will think that there is one olfactory nerve on each side, but anatomically speaking, there are 13 to 20 olfactory nerves on each side, 13 to 20 pairs. But physiologically, it is considered as a single nerve, physiologically. Anatomically, there are 13 to 20 pairs of olfactory nerves on each side. From where do they originate? In the nasal mucosa, lining of the nasal mucosa and lining of the nasal septum, there is a special type of epithelium which is known as the olfactory epithelium. We have seen the structure of dorsal root ganglion, isn't it? In histology, we had seen the dorsal root ganglion, which has pseudo-unipolar neurons. But in the olfactory epithelium, another type of neuron is seen, which is called the bipolar neurons. The processes of these bipolar neurons, they pass through the cribriform plate of ethmoid and finally end in the olfactory bulb. So I will show you a small model. Actually, this is made up of a bunch of circles which represent the axons of each bipolar neuron. So here you can see several neurons. There are millions of neurons lying within in the olfactory epithelium of the nasal cavity. Their processes form small bunches and they penetrate the cribriform plate of ethmoid. After reaching the cranial cavity, each nerve is covered by the pia mater, then comes the arachnoid mater, and then comes the dura mater. Between the pia mater and arachnoid mater, there is a space. Which space? Subarachnoid space. Very good. Subarachnoid space is filled with what? CSF. Very good. So, when there is a fracture of the cribriform plate of ethmoid, what will happen? The coverings of the olfactory nerve also get torn. The pia mater, the arachnoid mater, and the dura mater also get torn, as a result of which what will happen? The subarachnoid space, from the subarachnoid space, the CSF begin to leak through the nasal cavity. Remember the first slide in which I had shown you a 30-year-old man who sustains injury to the base of the skull. So you can imagine that the cribriform plate of ethmoid is involved, as a result of which the CSF is leaking through the nose. What is this condition known as? It is called the CSF rhinorrhea. In such case, there will be lack of smell. The smell cannot be appreciated by the person. Okay, that is known as anosmia. So that is the first cranial nerve. What will happen if there is a fracture of cribriform plate of ethmoid? We had just seen it. I have brought a model, a simple model of the formation of olfactory nerve, and you have seen the coverings of olfactory nerve, and you know that between the pyometer and arachnoid meter there is a subarachnoid space. So when there is a fracture, there will be CSF leak through the nose, which is known as CSF rhinorrhea. Anosmia is a condition often complained by the patient. It can be due to so many reasons. The commonest cause of anosmia is common cold or rhinitis. It can be a bacterial infection, it can be a viral infection, even allergic rhinitis. And 2 years ago, we had an epidemic worldwide, isn't it? So that was COVID. So patients who were affected by COVID also complained of anosmia in the beginning. This is the olfactory epithelium in the nasal cavity. You can see the bipolar neurons. These are the bipolar neurons. These are the fibers passing through the cribriform plate of ethmoid, and they form bundles which receive the meninges as their coverings. This is the nasal mucosa, which shows the processes of the bipolar neurons. Second cranial nerve is the optic nerve. It is a purely sensory nerve. Olfactory nerve is also a purely sensory nerve. The optic nerve is concerned with vision. In the retina, there are 10 layers. The 10th layer of the retina, it is known as the ganglion cell layer. The axons of all these cells join together, and they are covered by the 3 layers of meninges, and this nerve is known as the optic nerve. So just like the olfactory nerves, the optic nerve is also covered by the 3 meninges. The 2 optic nerves join together to form a structure called the optic chiasma. When we do the dissection of brain, we will see the optic chiasma. The third cranial nerve is in this picture, you can see the optic nerve. This is the eyeball. The lining of the eyeball, innermost lining of the eyeball is the retina. The fibers from the retina, they join together to form the optic nerve. It is covered by the 3 meninges, and the 2 optic nerves coming from the 2 sides, they join together at a junction which is known as the optic chiasma. In the subsequent dissections, we will be able to see the optic nerve and optic chiasma. The third cranial nerve is the oculomotor. If you split the word into 2, motor means fibers to the muscles. Oculo means pertaining to the eyeball. So it is a nerve which supplies the muscles that move the eyeball. That is why this nerve is called oculomotor. The oculomotor nerve supplies several muscles which move the eyeball. The oculomotor divides into a superior division and an inferior division. When we do the dissection of the orbit, I will show you the branches of the oculomotor nerve. At present, you just know that the oculomotor nerve supplies some of the muscles which move the eyeball, like levator palpebrae superioris. It is the muscle which helps in elevating the upper eyelid. the superior rectus. There is a straight muscle called superior rectus. It also elevates the eyeball. There is a medial rectus which moves the eyeball towards the medial side. There is a inferior oblique and inferior rectus. These are the branches of the oculomotor nerve. The fourth cranial nerve is called the trochlear nerve. Remember, in the initial slides, I told you that trochlear nerve is the only nerve which emerges from the dorsal aspect of the brain. Why is it called a trochlear nerve? Look at this muscle. This muscle is called the superior oblique muscle of the eyeball. This muscle passes through a fibrocartilaginous pulley or a trochlea. So, trochlear nerve is a nerve which supplies a muscle that passes through a trochlea or a fibrocartilaginous pulley. That is why it is called a trochlear nerve. And this is the only structure, only muscle that is supplied by the trochlear nerve. They are made for each other. The trochlear nerve and the superior oblique muscle of the eyeball, they are made for each other. Trochlear nerve is a purely motor nerve, does not supply any other structure in the body or the orbit. That is our trochlear nerve. The next cranial nerve is the trigeminal. I told you that it is the thickest nerve or the largest nerve among the cranial nerves. Do you know why it is called trigeminal? Tri means three. So this cranial nerve has three divisions. It has three divisions. One of these divisions goes to the orbit. It is concerned with supplying sensory supply to the structures lying within the orbit. So it is called the ophthalmic division of trigeminal nerve. Ophthalmic, pertaining to eyeball and associated structures. The second nerve, this is called the maxillary division of the trigeminal nerve. Maxillary division, it supplies the skin overlying the maxilla, the upper set of teeth, part of nasal cavity. So many structures are supplied by the maxillary division. Both the ophthalmic division and the maxillary division are sensory. They don't supply any muscles. The third division of the trigeminal nerve is the mandibular nerve. When we studied the pharyngeal arches, I told you that the structures, all the structures developed from the first arch, they are supplied by mandibular nerve because it is the nerve of the first arch. The mandibular nerve supplies, can you name some of the muscles supplied by mandibular nerve? Muscles of mastication. Muscles of mastication, the tensor palati, tensor tympani, these are all supplied by the mandibular nerve. So these are the three divisions of the trigeminal. The abducens nerve, sixth cranial nerve, it has the longest intracranial course. Why is it called abducent? Look at this picture. There is a muscle in the orbit which is called the lateral rectus. It is the abductor of the eyeball. If you look carefully, the abductor of the eyeball is supplied by a nerve, cranial nerve, which is called the abducent. So this word is derived from the fact that this is the nerve which supplies the abductor of the eyeball. That is why it is called abducent. Just like the trochlear nerve and the superior oblique nerve, the abducent nerve and lateral rectus, they are made for each other. The lateral rectus muscle is supplied by the abducent nerve. This nerve does not supply any other structure, does not have sensory branches also. That is the sixth cranial nerve. The seventh cranial nerve is the facial nerve. In the dissection hall, we have already dissected the face, we have dissected the parotid gland. You have seen the association between parotid gland and the facial nerve. You have seen the relations, you have seen the branches. So facial means pertaining to the face. And when we studied the pharyngeal arches in yesterday's class, I told you that the facial nerve is the nerve of the second pharyngeal arch. So all the muscles which are derived from second pharyngeal arch, they are supplied by the facial nerve. The eighth cranial nerve, it is called the vestibulocochlear. It has two functions to perform. It supplies the organs of balance like the semicircular canals and the utricle and saccule, and it also supplies the cochlea, to be more specific, the organ of Corti. It is supplied by the cochlear nerve. So this nerve is important because it helps in the maintenance of balance as well as the sense of hearing. The ninth cranial nerve is called the glossopharyngeal nerve. Glosso means pertaining to the tongue. Pharyngeal means pertaining to the pharynx. So the glossopharyngeal nerve is the nerve of the third pharyngeal arch. I told you in my last class, only one muscle develops from the third pharyngeal arch, that is the stylopharyngeus. So stylopharyngeus is supplied by the glossopharyngeal nerve. And this nerve also supplies the tongue. The general sensations as well as the taste sensation from the posterior 1/3 of the tongue is also carried by glossopharyngeal nerve. That is why it is called a glossopharyngeal, because it supplies the epithelium or lining of the posterior 1/3 of tongue, and it supplies one of the muscles of the pharynx. The 10th cranial nerve is called the vagus. Why is it called the vagus nerve? Look at the picture. You can see a person who is a wanderer. He does not have a house, he does not have a shelter, he wanders from place to place. It is very interesting to note that the name of this nerve comes from the word vagabond. Vagabond, in Malayalam it is called a nadodi. So this nerve has a long course. It is the largest parasympathetic outflow in our body. And the vagus nerve arises from the medulla oblongata, then it comes out through the jugular foramen, reaches the neck, supplies several structures in the neck like the laryngeal muscles of the palate, hundreds and millions of smooth muscles of the larynx, smooth muscles of the trachea, the numerous glands in the neck, and then it reaches the thorax. It is very happy, so because the heart is there, lung is there, always moving about. So the vagus nerve supplies all these structures. Then there is a long tube, the esophagus. It supplies the esophagus also. After that it reaches the abdomen, where the vagus nerve is more thrilled and excited to see the stomach and the meters of small intestine. Then it is again happy to see the small, tiny, cute appendix lalla, and then the colon, cecum, ascending colon, and the right 2/3 of transverse colon. All the glands in the stomach, all the glands in the small intestine, large intestine, the smooth muscles in the walls of the GIT, the heart, the lung, all are supplied by vagus. There is an interesting story about a tiny branch supplying the external auditory meatus. In the olden days, the lords and the princes, they used to throw parties where the invited guests, they used to carry a small wisp of cotton. Just before the banquet, these invited guests, they used to tickle the external auditory meatus. Do you know why? Without knowing the anatomy, without knowing the physiology, they knew that by tickling the mucosa of the external auditory meatus, they developed a hunger. Because you are stimulating the vagus nerve, this leads to increased secretion of gastric juice, so they will develop hunger. As a result, they can enjoy the banquet. And you have to be very careful about this nerve which supplies the external auditory meatus. In ENT, there is a procedure called syringing. Some of you will be having pets at home like a meow or bow wow. So these animals will be having small ticks or bugs on the skin. So these animals can enter the ear and they will bite the tympanic membrane. The pain is so severe, the patient is rushed to the ENT surgeon. And how can you remove this insect? It is biting the tympanic membrane, so you have to syringe water into the external auditory meatus. And the surgeon has to be very careful in maintaining the temperature of the water which is used for syringing. It should be at body temperature. If it is too cold, if it is too warm, it will stimulate the vagus nerve. You will develop bradycardia and can fall dead. Okay, so stimulation of the vagus nerve can cause hunger, and at the same time, overstimulation of the vagus nerve can cause bradycardia and death. So be careful when you are dealing with the vagus nerve. This is the vagus nerve. I told you it is a wanderer. See the course of the vagus nerve. Starts from medulla, reaches the neck, enters the thorax, supplies the structures in the thorax. After that, it enters the abdominal cavity, supplies the meters and meters of small intestine, the stomach, part of the large intestine, up to right 2/3 of transverse colon. That is our vagus. Accessory nerve, actually this word is derived from assistant. Vagus nerve is a very important person. He should have an assistant to carry his bag, his files, all these things. So accessory nerve is actually the assistant of the vagus nerve. It has two components. This morning in the dissection hall, in the posterior triangle, we have seen the spinal part of the accessory. When we open the cranial cavity, you will be able to see the cranial part of accessory. This picture shows you the origin of the spinal part of the accessory. It takes origin from upper 5 spinal segments, enters the cranial cavity through the foramen magnum and comes out through the jugular foramen. We saw these two muscles forming the boundary of posterior triangle this morning. So they are supplied by this nerve. The cranial part of the accessory, it is actually the assistant of the vagus, and it forms a plexus along with the vagus to supply some muscles. In the subsequent dissection, we will see the structures supplied by the accessory. Hypoglossal is the 12th cranial nerve. See the word hypo. Hypo means below. Glossa means tongue. So hypoglossal means below the tongue. So hypoglossal nerve is also taking origin from the medulla, and through the hypoglossal canal, it reaches the side of the face, It lies on the hyoglossus muscle and supplies the muscles of the tongue. That is why it is called hypoglossal. So we started the class with a case history. A 30-year-old man sustained injury in road traffic accident. There was a fracture of the base of the skull, including anterior cranial fossa. This person was seen to have clear watery fluid leaking from the nose. He gave a history of anosmia. So now can you tell me the answer to this question? What is the answer? Yes, which cranial nerve is involved? The olfactory, very good. What are the coverings of olfactory nerve? The meninges, very good, excellent. So now you know the basics, isn't it? Okay, which is the 13th cranial nerve? Nervi terminalis, very good. So with this we come to the end of this session. In the next class, after a break, you can go to the dissection hall. We will open the cranial cavity today, and we will see the cranial nerves attached to the brain, and we will see the numerous foramina in the skull through which these nerves are leaving to their destinations. Okay, thank you.